Welcome to this video animation of the anti-inflammatory reliever-based therapy for asthma. Air-based therapy is the use of a 2-in-1 combination inhaler containing both a corticosteroid and a fast-onset beta-agonist, used as a reliever instead of a short-acting beta-agonist. The combined inhaler is used when needed to relieve symptoms. Let's take a closer look at the rationale for this approach. Asthma is a disease in which the activity fluctuates with time. Occasionally asthma attacks will occur, and these can be mild or severe. Regular scheduled maintenance treatment is prescribed for baseline disease activity. This results in periods of overtreatment, but also periods of undertreatment. However, adherence can be less than 50%. Which means that maintenance regimes may be undertreating asthma most of the time, and they do not adapt to increased treatment need during attacks. So how does air therapy, taken as required to relieve symptoms, work? If symptoms are getting worse, patients can take extra anti-inflammatory reliever treatment as needed. This tops up the steroid treatment to match the severity of the attack and reduce how severe it becomes. In moderate and severe asthma, the same inhaler is used for both maintenance as well as the relief of symptoms. Regular scheduled maintenance treatment manages the baseline disease activity. As needed reliever use titrates the dose of anti-inflammatory treatment to what is required to manage asthma flares. In mild asthma, however, the disease activity is lower, and so only as needed treatment is required. There is strong scientific evidence from randomized controlled trials that the air-based therapy reduces the risk of severe exacerbations across the spectrum of asthma severity. If we look first at the panel on the left for patients with mild asthma, compared with a short-acting beta-agonist taken solely as reliever therapy, a combined ICS fast-onset long-acting beta-agonist drug taken solely as reliever therapy reduces the risk of a severe exacerbation by between 60 and 64%. If we turn now to the right-hand panel, in patients with moderate to severe asthma taking maintenance ICS-LABA therapy, compared with a short-acting beta-agonist reliever therapy, if they take the combined ICS-LABA as reliever therapy, this will reduce their risk of a severe exacerbation by between 20 and 44%. Based on this evidence of better outcomes, safety and ease of use, air therapy with a combined inhaled steroid fast-onset long-acting beta-agonist is now recommended as the preferred reliever therapy rather than a short-acting beta-agonist in adolescents and adults across the spectrum of asthma severity.